अगर
जी
मैडम
जी
बोले तो
सर।
मैडम को, मैं बोलूँ तो
हाँ
मैं, प्रवीण
बिल्कुल
बोले तो
बिल्कुल
जो पैनलिस्ट बोलेंगे ना उसको स्क्रीन पे लेना, उसी व्यू पे लेना।
बिल्कुल बिल्कुल सर बिल्कुल।
और मैडम अपने आप करेंगी और गिरीश की और प्रवीण की मैं करूंगा स्लाइड
ओके
शेयर।
ओके।
बतूल काउंट चालू कर दो, 6 बज गए।
Yes sir. Countdown begins. 3, 2, 1. Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our extreme panelists who are present here with us today upon the topic that is going to be shared. So the topic for today's session is stress management in medical professionals. And I would like to welcome all the eminent stalwarts who are present here with us today for delivering their talk on this topic for today's session. Before moving on to today's session, let us have a brief look on what the topic says. Stress management is a paramount concern for medical professionals who face demanding and emotionally charged work environments. Effective strategies are crucial for maintaining both personal well-being and quality patient care. We'll be learning more about these strategies encompassing mindfulness techniques, work-life balance, and peer support to safeguard their mental and physical health. So now, without any further delay, I would like to welcome our moderator for today's session. Well, he needs no introduction, but yet it's our pleasure and an honor to introduce him. He is none other than the very renowned Dr. R.M. Chabra, sir. Sir is MD in Medicine, FIMSA, FICP, FDI, FRCB, Edinburgh, certified course in diabetes recognized by BMG Royal College of Physicians and Fortis CDOC. Sir is also the senior consultant physician and director at Chabra Medical Center, Pitampura, Delhi, Max Shalimar Bagh, and Saroj Super Speciality Hospital, Delhi. So is also the founder president, North Delhi Physician Forum, Delhi, past faculty member of Indian College of Physicians, API, and member editorial advisory board, JAPI. So is the past chairman and secretary at API Delhi State Chapter. So was also the past treasurer and executive member at CSI Delhi branch. He is also the state executive member at IMAD and DET, publications in national and international journals. Sir is the ex-governing member of Association of Physicians of India. Sir is also the ex-chairman, Physician Welfare Committee at API. Sir was also the Sundarlal Rupvati Award, Delhi Medical Association 2005. Sir was honored with the Distinguished Service Award of WCCPGC 2008. Sir was also awarded by Bharat Ratna, His Excellency by APJ Abdul Kalam, the former President of India. Sir has also got the award for Sudarshan Grover Award, Delhi Medical Association from Delhi North Zone 2000, and so on. The list continues. So now, without any further delay, I would like to welcome Sir. Sir, the stage is all yours. Please continue.
Thank you, Batul, for the kind words. So everybody is under tension nowadays, but how to manage? We have very legend or stalwarts in the field of the medicine. They don't require the introduction, but on the customary, I have to give the introduction. First, our panelist is Dr. Sharda Sen. She is a director of the Life Care Center in the Life Care IVP, and in one word, she is a teacher of the teachers. She has had illustration of the national position like the medical advisor of the National Commission of the Women and faculty. She had been the faculty more than 2 decades at the Chandigarh as well as the Lady Hardinge Medical College. She's a founder and secretary general of the DGF, and she's also founder and chairman of the WOW India and member of the expert on the Australian gynae in the ethical committee MCI, and again and founder of the Pushpanjali Institute of the IVF infertility, and now the part of the Max Super Specialty Hospital Vishali, and she is the president of the Association of the Medical Consultants and Delhi, and co-founder and president of the Association of the Women Reconstruction and the aesthetic surgeon, and also she is the founder and the co-chairman and the medical legal former, and she is behind the many national movements, be the female feticide movement against the anemia, Janani Suraksha Yojana, and uniform rape victim examination, save uterus campaign, and say no to the cervical cancer, and many other to the her credits, and decorated by the Lifetime Achievement Award and Living Legend Award by many prestigious bodies, and she has a number of the publication in the journal, in the national as well as the international journal. Another in the none other than the Dr. Girish Tyagi. He is a registrar of the Delhi Medical Council and past president of the DMA, past secretary of the DMA, and past finance secretary of the DMA, and past senior vice president of the DMA, and past associate editor, Delhi Medical Association, and past joint secretary, and past president of the India IMA, Delhi North Zone, and a keen interest in the sports, blood donation activities issued pertaining to the medical practitioner, anti-quackery, and assault and assaultment of the doctors, past member of the anti-doping committee, and the past member of the Athletics Federation of India and Health Services Subcommittee and the Commonwealth Games in 2020, 2010, and awarded with the Lifetime Achievement Award by the DMA, and Doctors of the Year Award by the India IMA headquarters, and recipient the Distinguished Award by the Vigyan Bhavan in the Platinum Jubilee celebration of the Safdarjung Hospital. And another stalwart, none other than the Dr. Praveen Bhatia. He is the medical director of the Bhatia Hospital, senior consultant physician with the special interest in the diabetes, and medical director of the Bhatia Hospital, formerly at the Sir Gangaram Hospital, and worked as the research fellow of the ICMR, and member of the IMA and MACP and MAPI and Jocelyn, and attended various domestic and international conferences, delegate and the faculty, and has a numerous number of the publications in the CME lectures, past executive and joint secretary of the DNZ and IMA, and present executive member of the North Delhi Physician Forum, presently running on set up a Bhatia Hospital, Delhi, and senior vice president of the IMA, DNZ. Another is very, very young generation, young dynamic person, none other than the Dr. Avril Mathur, and he is a senior resident of the Maulana Medical College and the Loknath Hospital, New Delhi, and senior resident of the Maulana Medical College and Noklai Hospital, New Delhi, national president of the FORDA, and president resident RDA, and the MEMC and the Loknath, and WHO award for the excellence of the healthcare and COVID warrior award for the government of the NCT of Delhi, and Delhi Medical Association Distinguished Service by a Young Doctor Award, and American Heart Association Certified BLS and the ACLS instructor, and member of the Airway Management on the Foundation of India, simplified transfer of the knowledge and skill pertaining to the both anesthesia and the leadership, and fight for the what is right and the rational and out of the box approach to the common problems in the airway. So they are the very leading persons and the stalwart in the field of the medicine. So I will go for the today topic. I will say stress in the medical professionals was almost nil or the at least in the both sector, either in the private or the government, when our profession was considered as a noble one, when there was no political interference in the healthcare system, when there was no Google Baba advice or the guidance, and no businessman or the corporate involvement in the interference in the healthcare system, and no consumer protection or the CEA Clinical Establishment Act in the healthcare system, people were satisfied with the available and the provided treatment offered to them with the available resources or the infrastructure. But as of today, the burden of the doctors, the heaviest burden that they carrying are the thoughts in their mind like this picture. So they are very more burden. So impact of the stress leads to the physician burnout, either the personal or the professional. Personal, they will end up in the broken relationship and alcohol abuse or the drug abuse. They will go into the depression and they will commit the suicide. The recent example, the late Dr. Archana Sharma. And what about the professional? They will decrease the quality of the care and the chances of the medical error will be more and decrease the patient satisfaction and decrease the productivity and the professional efforts. So this is the connection between stress and the performance. If the performance is very very high, if the stress is very very low, similarly it is reverse. If the stress is high, the performance will go down. So similar in the picture, what are the sources of the energy which keeps us the stress free or the healthy fit and give to the better performance? That is the food. Everybody knows because you are a doctor, you know air is very very important. Another is the sleep, adequate sleep, because doctors are not getting these things. The basic things that the doctor are not getting. That's why they are under the stress. That's why I show this slide. The adequate sleep is 6 to 8 hours, either over or the under. Both are harmful, and exercise and meditation everybody knows. Then water and the fluid is also important. That's why we say the electrolyte imbalance balance is very very important to maintain the to keep yourself fit. So what is the human age? The human age is the cycle from the birth to the death, and to keep ourselves healthy and fit throughout the life is an art. If you don't know the art, then you cannot keep your healthy. Health and fitness are the interrelated art. The health is the physically, mentally, and socially and spiritually. If you are healthy, then you are stress free and the healthy and will do the better performance. Then today we will talk about the mental health. That is the stress. What is stress? Stress. What is stress? Stress right from the time to the birth till the last breath of the turn. An individual is invariably exposed to various stressful situations. Even in the fetus in the womb, there is a distress. You say the fetus in the distress. So the modern world, which is said to be a word of the achievement, is also word of the stress and the head called the age of the anxiety and the stress. And definition of the stress, the word stress was originally used by the Stalin in the 1962, describe the pressure of the experience in the person, respond to the life, the demand. These are the demand. These are the stressors. Stressor is a stimuli proceeding or the precipitating the changes. It may be an internal fear or the guilty or the external trauma or the peer pressure. So these are positive stresses that will also better. Positive stresses result into the enable you to concentrate, increase the performance, energize you, and make the good performance. Similarly, you stress the optimum amount of the stress, which helps to promote the health and growth. That if you are praised by someone, then definitely your performance will be better. So type of the distress, stress is due to the excessive activity demands placed upon us. The demand are so great that lead to the bodily or the mental changes that is unexpected. Similarly, example, the unexpected death in the loved, then there will be the stress. So in negative stress, these are the stress that will cause the anxiety, short term or the long term, or the coping of the ability, and please the unpleasant, decrease the performance, can lead to the mental or the physical problems. So what is the stress? If you are unable to handle the situation or the challenges, then it will go to the stress. So in the last, I will tell you the symptom. Symptom, people will dilate or increase individual perception. So, there will be sweating and heart rate and cardiac output will increase, and skin and palate, and due to the peripheral vascular constriction, and mouth will may become dry, and urine output is decreased. So first question to Dr. Sharda Jain. Being a competent obstetrician and the gynecologist, as per your experience, you must have faced a lots of the stresses during your medical career from resident to the present top level. Kindly enlighten us and show to the stresses you faced. Tell us, ma'am. Tell us. I am stopping my
Can I share?
screen.
Can I share my screen?
Yeah, yeah.
Yes.
I am stopping my screen.
Yes.
Yes, ma'am. You can share.
Yes, I can share. At the outset, I think, Dr. Chabra has uh, given a very great start of this particular panel discussion. Medical profession is highly stressful, especially these days. He's talked about the history when we were absolutely happy and healthy profession. We used to enjoy this particular thing, but now it's not there anymore. And this is because of many, many things. And I think, yesterday I was in a panel which was organized by the gynecologist, again, on the professional burnout. And today I'm glad that your association has taken up Pan India to hammer the point that stress होके कोई फायदा नहीं, अपनी जिंदगी ही आप कम कर रहे हो. This is a study which has been done very recently during COVID times, and you can see here that the highest people who are stressed as far as Indian doctors are concerned, the people who are in emergency or in critical care. But you can see we gynecologists are third in number. Around 53%, we are stressful. And no doctor can say कि उनको stress नहीं है. Everybody is stressful. And I will say here, this is nothing to do with the COVID times. Though this particular study has been done in the COVID times, it has nothing to do with the COVID times. Dr. Chhabra has just highlighted what are the pressures these days which make us stressful. Now, long working hours. Yes, when I went to PGI Chandigarh, their duty hours were 12 hours. By the time we came back to the room, it was 9:30. And then if you want to read at that particular time, you could not read. And then all of us decided to get up early in the morning at 4 o'clock. And then we started working on it. Then as a faculty, we found that we were very stressful when we are training postgraduate and senior resident. tab tak unko haath ka kaam nahi sikhaoge, total responsibility is ours. It's not of the postgraduates. So I think, that time also you're very stressful. But if you want to be a good teacher and you want to remain in a medical college, you have to teach people. And in private practice, जब ऊपर वाला मेहरबान होता है तो पेशेंट्स आर enormous. आपको समझ ही नहीं आता कि क्या क्या हैंडल करें, क्या रिफ्यूज करें. But I think, one day the time dawns कि ये पैसा ऊपर नहीं जाना, so things work out in our place. Again, heavy load of work. I can see what is happening in the OPDs of our government colleges, the medical colleges. It's so much of load of work, which itself causes fatigue and stress. The casualties, and again, the same is seen for a private practitioner who are successful. So what I feel is prolonged shift. Outside in the Western world, in the developed world, they know it that more than 8 hours you spend with the patients, it is definitely going to affect the quality of care of patients. There are studies after studies which shows the extended hours definitely compromise on a quality of care. And we all doctors start our working life late. And by the time we settle down, there are a lot of loans, monthly EMI for car, for flat, always all pressure, give a pressure to generate money. And then the long hours is inevitable to generate. And with the result, we have a lot of health risk. Dr. Chhabra just mentioned about the sleep disorders, depression, anxieties, plus. And you find this suicide rate of doctors has doubled in comparison to general population. And cardiovascular issues are far too many. Yesterday, I was one embryologist was with me, decorated embryologist, and he says he got diabetes at the age of 28, and he had 2 stents by the time he was 40, and he decided he will not allow this to happen to his juniors. The same way, cardiologists having heart attacks, even lady cardiologists having heart attacks, I think is something to be worried about. The question comes, can we afford to fall sick? I'm not talking about simple cold, cough, and headache. I'm talking about, when you know it for sure that I'm going for a major problem, you cannot ignore it. What we find is a lot of responsibility for we gynecologists. We manage to life. Kisi ka bhi loss hoga, so the litigation becomes plus, and whole life earning you have to spend in litigations. This study had been done in orthopedic people. They found that the result of this overwork was emotional exhaustion, depersonalization, and loss of personal accomplishment. Your personality is lost. आपको समझ ही नहीं आ रहा है ये क्या हो रहा है. And every specialty has its own intensity and complexity, and the elders can only tell how to handle their emotional problem. Whenever there is a work-life balance, it goes here this way. Sir also mentioned the personal life goes away, and the divorce rate increases. We don't have an Indian data, but Western data definitely show that. And we find, the emotional stress is seen when we find our patient is having a loss. ART, we find the cycles after cycles are not successful. Elective surgery, if something goes wrong with the patient, you are absolutely stressful. And if death occurs, God only save us. So nobody, the administrative work, I say all doctors like their medical work. वो कितनी सर्जरी कर लें, कितने प्रोसीजर्स कर लें, थकते नहीं. They are happy at the end of the day. But administration definitely drains them. And doctors do not like administrators. But when they become administrator, the stability of job is not there. एक साल यहाँ रहेंगे, एक साल वहाँ रहेंगे, because they cannot deliver the goods which are there. So I think whenever there you are in a private practice also, administration has to be taken care. And if you want to cut the corners, you want to do it yourself. And the result it shows on your health, both emotionally and physically. So the biggest burnout is administrative work and administrative work. I think, there is in a private practice, there is a, lack of support system is there. I also find, once I have taken almost, my practice have decreased to almost 40%. Morning OPD, we have a lot of staff with us. But in the evening OPD, I'm alone. I find it just becomes stressful. Then, to become a doctor, especially if you're going to a private medical colleges, their high cost of medical education and indemnity insurance and litigation expense, I think drains away the doctor. I again repeat that the doctors are not earning much. I've seen RMOs, senior RMOs, do two shifts these days to meet the two corners of the expenses. Then we find, that the expectation of the patient is touching the roof. And that is contributes stress. And you said they become Google Baba, knowledge is with them. And this, when they come and talk, it really frustrates the doctor. And what we find is that all this influences, when we do not have a peer support. Peer support is now started building up, but the professional rivalry is so much. 90% of the litigations, Dr. Tyagi is here, are instigated by your colleagues. Something has to be done about this particular thing. And there's a real threat of violence against the doctors. And I think all of us are really scared of this particular thing, that is violence against the doctors. And with the result, not only the second phase of the same thing is litigation against us. On an average, a gynecologist face the 50% of litigations in this country. An average gynecologist has 5 litigation in their career time and 2-3 at the current level. And you find indemnity insurance, though we take it for ₹1 crore, it is of no help. 50% gynecologists decrease obstetric practice by the time they become 45, and 10% leave it altogether. One can emphasize that, whenever we're trying to neglect, we don't keep update ourselves. Small courses are also costly. But when we cut down corners, we want to learn everything free of charge. We do not have the knowledge and we pay a heavy price for the same. And workplace these days, conflicts are there between the doctors and the nurses. And this take away extra time and cause an extra stress. Professional rivalry, all of you know about it. Now, what we are worried about, the violence against the doctors and, damage to their property. There is a law, but, the police people ignore that there is something law like this. I think something our association has to really work hard on this particular aspect. And mental health is a problem. It can happen to doctors also, but there's a big stigma available to it. And that's why the doctors who have the problems do not take the help. And coping mechanisms are not taught to us in 4 walls of the medical college. And that's why we are at the crossroads. So with this particular thing, I think I can say life is stressful as far as the gynecologists are concerned. So done with it.
I think, sir, you're mute. Chawla sir, आप शायद mute हैं.
डॉक्टर छावड़ा अनम्यूट करें. डॉक्टर छावड़ा आप अनम्यूट करें. Dr. Chhabra, unmute करें.
Sir, unmute yourself.
Yeah. Dr. Sharda Madam has lighted the each and everything she has gone through, the stresses. Thank you very much, ma'am. Now I will come to the second question to Dr. Bhatia. My question is. Question to Dr. Bhatia.
Yes. I'm
Being
here.
a senior physician, as per your vast experience of the about 3 decades, you must have come across stresses parallel to your professional journey from the resident to the present top level. What are the different origins of the stresses and the challenges you met with? Kindly enlighten us. I am
Yes.
sharing your screen slide.
Yes, Dr. Sharda, Dr. Chhabra, you have explained so well about the challenges we are
And
facing.
Dr. Bhatia ki photo lalo. Yes.
The challenges we are facing nowadays. The moment a person decides that he wants to be a doctor, the stress starts there only. As we have seen last few days, a lot of students who are giving competition or medical entrance in Kota, a lot of them had done suicide also. So stress is definitely a part of life, no doubt. But Dr. Chhabra has very well told, one is a positive stress, other is a negative stress. Positive stress is very important to achieve the goals. But negative stress, when continuous negative stress leads to the burnout syndrome, and these suicidal problems are there. As a physician, the road to become a physician is, of course, very competitive and intense. Next slide, please, Dr. Chhabra. So basically, what the physicians are supposed to do, we are supposed to do to take care for the patients, number one. And number one, we are supposed to diagnose the patient and treat the patient accordingly. And if required, a referral is to be done. But in contrast, as has been told by Dr. Chhabra, in around 4 decades back, there was no internet, and we used to run from pillar to post for personal referrals, collecting reports from the labs, and then maintaining files. But now these challenges are not there anymore. But in the phase of Wi-Fi and internet, these problems have been solved now. But we have been trained to become physicians who care for patients. We are supposed to care for the patients. We are supposed to diagnose the patient properly, and which are supposed to concentrate on the patients. But what is happening really is we are increasing nowadays in the consumer era. We are being seen as a providers who give service to the clients with a growing sense of mistrust. Our clients are not trusting upon us. Still, we are supposed to give the best possible service. Next slide, please. So what it takes, what are the results basically? It creates obsessiveness, it creates compulsiveness, and there is definitely increased sense of responsibility in the doctors. Doctors think that they are to take a lot of responsibility, and unsustainable, unachievable goals are sometimes there. And there is chronic feeling. Most of the doctors, when they are stressed out, chronic stress leads to the chronic feelings of not doing enough. They are supposed to do more, but they are not being able to do enough work. So there are difficulty in setting the limits for the doctors. When they feel difficulty in setting the limits, then it leads to stress. Next slide, please. So what stress exactly is? Dr. Chhabra has very well defined positive stress and negative stress. It's very important to have the positive stress. But a condition is experienced when a person perceives, anyone perceives, supposing I perceive that demand exceeds my personal and social resources, that I will be stressed out. And I'm unable to cope with my works. Continuous inability to cope with the work leads to stress, and continuous stress leads to definitely syndromes. So having little or no control is always distressful. That is a negative stress when not having control. Next slide, please. So the practice of medicine is, of course, changing nowadays. Longer hours were there also before, also even nowadays longer hours are there. But now what is happening is more of paperwork. The government and the authorities are requiring more of paperwork, and there is decreasing compensation. What we are doing, we are not given credit for the same. If some patient gets cured, then credit is given to someone else, not to the doctors. And there are stringent, very strict government and insurance regulations are there, which doctors are supposed to follow basically. It definitely leads to stress, and we are not being able to concentrate on the patients, his diagnosis and treatment. 100% concentration is not there. We are doing parallel to our work. Definitely parallel to our work, our concentration is being diverted to some other activities also. And besides that, we are always scared about the malpractice accusations. although our intentions were good, even now are also good, but still we are being seen with suspicious eyes. Next slide, please. So burnout, continuous tension and stress leads to, over the time, it leads to burnout syndrome. And it starts right from the medical school and continues in the residency, and then now even in the practice, it continues. I, being a nursing home owner, I'm running a nursing home. My work is, besides being a doctor, besides being a consultant, I'm supposed to see so many other things also. And we are supposed to take around about 100 licenses for running a nursing home with proper manner. So we are disillusioned, basically cynical, and it becomes very difficult to do a very competent job. But that is what doctor feels, that he's not being able to justify his job. Next slide, please. So what basically happened? What happens? What is the result of burnout? There is personal and family losses are there. Sometimes divorce rate has also increased in the doctors, and there's decreased productivity. And we are liable to do sometimes unintentionally medical mistakes because our mind is being diverted to so many other activities. And besides that, turnover of the patients is also being reduced because of this. Next slide, please. So it becomes very important right now. We all must address this issue. We must address the stress and prevent the burnout. Putting out the fire is very important and it's very urgent. Thank you very much, Dr. Chhabra. I would like to hand over the screen to you, Doctor.
Thank you, Dr. Bhatia. For the nice presentation, you have told in the CPA era, a very difficult physician burnout that I have told you. You endorse all the points, but very difficult, stressful condition, especially in the nursing home. You have to work as a resident as well as the owner also. So next question, my question to Dr. Avril. He is a very young doctor. And question to the Avril Mathur, being a president of the FORDA, let us know which type of the stresses resident doctors are facing while proceeding through their career in the present era. What is your opinion?
Yeah, hi, sir. Good evening. Good evening to all of you, and good evening to all the delegates who have joined us.
What PPT or
Sir, I'll share the screen, sir. I'll share the screen.
Okay. I'm stopping my screen. I have stopped my screen.
Ji, sir. Good evening, everyone. Good evening, all the respected panel members and all the delegates who have joined us today. As all of you have rightfully remarked, sir, I think my screen is visible to everyone now.
Visual.
Yes, sir. So, I was quite surprised by Dr. Shada's presentation that, the challenges never change. I thought that the challenges which I am going to present, which the young doctors are facing in this country, they never ease out. So this thing was very surprising for me. Many of the slides that she shared, you might find them repetitive here. But that is what the core and the crux of this presentation is, that, the stresses, as Dr. Bhatia also remarked, they begin when you start preparing for medical as a field, and they never end. I think that is the conclusion that we all will draw by the time this presentation ends. But as far as the residents are concerned, let me enlighten you with some of the pictorial representations which I have tried to, imbibe it into. As far, when I'm sure all of you were residents in your time, a young doctor was viewed as somebody, bubbly, dressed up in their nice little aprons, walking around the corridors of the hospital, having a cheerful life. But, the scenes have changed drastically now. That is not what we see today. Whenever I am walking by the corridors of my hospital and the other representatives in our body, they go to their workplaces. What we see daily is a resident who is frustrated, who is anxious, who is tired, who is tensed, who is, on a shift of more than 24 hours and is supposedly, going to do another duty for the next 12 hours, who has no proper, they are always, belittled for the dress up that they do. But what they forget is that, when a doctor is not able to go to the washroom, not have the very basic facilities of having to go to the hostel room to get, freshened up, you will often find them in dresses like sandals, t-shirts, and hairs all fuzzy. So this is a picture of the resident. This is a sad picture of the resident that we see today.
Dr. Avril, unmute yourself, please.
डॉक्टर साहब अनम्यूट करिए डॉक्टर अभिनव.
Dr. Avril? Yes.
Oh, sorry, sir. I think the connection went broke for a little while there.
Yeah.
Is
Continue,
the slide visible, sir?
Yes, slide is visible,
Yeah.
sir. You please turn on your camera.
Okay. All right.
Yeah, thank you.
Okay. So also, coming to the first stressor that we find, violence at workplace. As all of you have already remarked, violence, as we also tweet daily, is happening on a weekly basis in every major institute across this country. Right now, what we are also deliberating upon is that how the intensity of this violence has surprisingly increased in the last 4 or 5 years. Initially the violence was limited to some verbal abuses, some mishandling, but recently, the events have drastically changed, and they have surprised us by the magnitude of the violence that the residents are facing. Some are being, attacked by screwdrivers, like it was in Safdarjung a few weeks back. Some have been murdered, like the poor girl in Kerala, and some have been a victim of many other grievous injuries at the hands of the agitated attendants. And precisely as Dr. Bhatia also remarked, from caregivers, we have converted into somebody that, we have to abide by the certain norms that these patients and their attendants come with preformed notions about doctors. They already read about their diseases, read about their symptoms, and then when they don't find something in line with what they have read, the misinformation that they have, they tend to attack us. There is a growing sense of mistrust. And when they see a resident, who is so down in the food chain, they never really trust anything that he or she says. And then naturally, they, try to challenge whatever diagnosis they make, and they vent out their anger on them. So violence at workplace, as this Lancet study has also addressed in India, is a growing epidemic. I think all of you are aware. I don't need to focus much on this. But what is related to this, is the Central Healthcare Worker Protection Act. As I was already saying, I was in a meeting with the DGHS at Ministry of Health and Family Welfare today, and we are almost in the last stages of finalizing a draft for the Central Healthcare Worker Protection Act. They were taking the inputs from various other representations as well. But I think from where I see it, it's still a long road to go. Recently, a large rally was organized from Mamsi to Rajghat by DMA, DMC, and all of us came together for that. And all of us, the single umbrella under which we are fighting is trying to push this Central Healthcare Worker Protection Act at a national level, at a central level, trying to bypass the state laws, have something parent in place, and then, maybe publicize it, and maybe the perpetrators will understand that, doing this, as is visible in the picture, this is a picture of GMC Nanded in Maharashtra. This is a surgery resident lying on the stretcher. He was attacked by a knife. He got some injuries to his solid organs and luckily survived. But to what avail? Imagine the mental trauma and the stress that he has to live with. Coming back to the topic, at hand, other stressors which, apart from violence, are growing silently and nobody is noticing them, is the lack of infrastructure and training in the hospitals. This is a picture of an OT, not in India, but we have similar pictures wherein over a surgery, a surgeon is trying to show or elucidate something. There are around 6 to 10 surgeons trying to learn from just by watching the surgery. Because the number of residents per year are increasing, but there has been no proportionate increase in the infrastructure, the number of OT tables, the number of wards, the number of beds, and of course the number of faculties that are there. So all in all, it results in a learning that is mostly virtual. It's not very hands-on, and therefore doesn't add up to the experience a resident hoped he would have by the time he crosses his residency. Another challenge which we feel that is adding up to this stress is the skewed doctor to patient ratio in India. You see, WHO recommendation is very closely being approached by the healthcare professionals in India. We are almost near to this ratio. We are at somewhere around 1 to 900 or somewhere around 1 to 1100 based on which survey do you see. But the problem is not the ratio. The problem is the distribution. there are clusters, metropolitan cities, which have, a huge number of doctors. आप कहीं भी जाएंगे, एक, अगली गली में एक डॉक्टर है, उससे अगली गली में एक डॉक्टर है, एक क्लिनिक है, एक हॉस्पिटल है. And then you'll go to some far-flung areas, some peripheries in the state, which will not have any hospital for 200 to 300 kilometers. But the population density there is also almost similar as it is in other places of the state. So what it results is that, as Dr. Shada was also saying, that private practitioners are facing the brunt of it. Smaller hospital setups are facing the brunt of it. They are catering to a very large population. Naturally, the expectations are very high, and then they come at the receiving end of all that is bad, because they cannot satisfy everybody. So skewed doctor-patient ratio, along with the poor distribution of doctors in this country, is one reason. The distribution can be addressed by providing better salaries, better infrastructure, of course, and better incentives to the doctors who go out into these far-flung areas to practice. Again, many residents, which when I talk to them every day in my college or in other colleges, whenever they crack NEET PG and they go to different parts of this country, they hope that after residency, after cracking NEET PG, their lives are going to change suddenly. And that is not happening at all. Rather, the reverse is happening. Their life goes for a toss. Also, mentally, when we were being bred into thinking that doctors are somebody, who always mint money. That is what, my parents used to say, my neighbors used to say, ki, ab to aap paise chapoge, ab to aap ye karoge, wo karoge. And this was all a myth that was planted in our minds. The average resident salary in India is surprisingly only 65,000 rupees per month. This is the average I'm talking about. And what is 65,000 rupees per month for 3 years? And then next 3 years, you have to do a SRShip at a meager of 70 to 80,000.
We should concentrate on the stress of the
All right, sir. Sure,
salary is
sure,
also
sir.
a problem, but it is not stress.
So high workload, poor compensation is one challenge which everybody is facing. Again, Dr. Shada also remarked on this, that education fees through the roof, paying large installments, not getting enough money in return is again adding to the stress and anxiety of these students. And then, bond policy at multiple levels in the country. Recently there was a protest in Haryana, very large scale protest, wherein they had been thrusted upon by a bond sum of 20 lakh rupees. So, monetarily, the student is going into the backseat, is not getting paid, is being thrusted upon by very large amounts of fees, large amount of bond fees, and therefore is adding to all the stress that is already there apart from the work that he's doing. Of course, one thing which we have been closely following up this tenure of our FODA team is maternity benefits for female postgraduates in this country. Many female postgraduates in the southern parts.
You are exceeding the time, please.
Sir, yes, sir. This is the last slide, sir. So maternity benefits, we have been trying to get it for our female postgraduates. Currently, they're only getting leaves as per the NMC guidelines. They're not getting any monetary return, which in fact is counterproductive to the entire maternity scheme. And also, the inconsistent saga of never-ending exams, super specialty exams. This all is, compiling up, blowing into a bubble that might burst at any point of time. So we believe that the resident today is the hero that we need, but the hero we don't deserve. That is what we feel. Thank you, sir.
Stop कीजिए अपनी screen. Screen stop कर दीजिए.
जी sir.
डॉक्टर एवरी ने बहुत अच्छी चीजें बताई. No doubt, every frontline doctors are definitely under the stress from they are not getting the basic things like the washroom and all that. Everything is if there is a violence, the frontline doctors are under stress. So you are rightly said, everything explained, but sorry, time is limited. So now I will come to the Dr. Tyagi. Dr. Tyagi. My question to Dr. Tyagi, being a registrar in the DMC, many doctors come to DMC due to the medical legal litigation. What kind of the stress do you observe on the face of the doctor once they come for attend the hearing? Because everybody, either the patient or the complainant, comes to the DMC. So what are your opinion? Let me know. I will share your slide. Your slide, please. Dr. Tyagi, please. Hello?
Tyagi, unmute करिए.
Yeah, next slide, sir.
Next slide.
as our all learned previous speaker told about that stress is from the resident to that senior level members, they are all facing the stress because of one reason or the other. And when the complaint is being filed against the doctor for the professional misconduct and negligence, and ultimately if the concerned person is practicing in Delhi and registered with Delhi Medical Council, it will come to Delhi Medical Council. And there are various stresses for that matter. The utmost importance is the professional reputation, which is of utmost importance, because once the complaint is being filed against the medical council, and then the person is a doctor is being called to the disciplinary committee for the hearing, in which, as we told you, that being accused of medical negligence, it can tarnish the image, whether the doctor is being convicted or not. But when the complaint is being filed or is being asked to come to the Delhi Medical Council, it can tarnish that image, because of that there is a professional reputation is always at risk when the person is being called to Delhi Medical Council for the hearing or a complaint is being filed against them. Then there is a potential legal consequences, because once a complaint is being filed to Delhi Medical Council, the doctor is being called to that. Then the doctor is under the stress that if anything goes wrong at the Delhi Medical Council, that based on that judgment, that person can go to the consumer court, criminal court, or to the civil court for that matter. So potential legal consequences is of very importance when the doctor is being called to Delhi Medical Council for hearing. Then emotional toll. There, as you all know, there is a strong bond between the doctors and the patient. But once that particular patient against whom the doctor feels that is a very strong bond, there is a connectivity with that particular patient, and he filed a complaint, then there's a feeling of guilt is there, feeling of shame is there, feeling of anxiety is there. That such person whom he has served for many years, whose family has been served by that particular doctor for many years, and they have filed a complaint for the silly reason. Then uncertainty of outcome, because outcome of malpractice case, we all know that outcome of malpractice case is uncertain, which can cause anxiety to that person, because what the outcome is, nobody knows, and it also causes the anxiety, stress to that particular doctor. Then, of course, time consuming. As you all know that time consuming and the energy consuming simultaneously, because preparing for when the complaint is being filed against the doctor, then he has to prepare the case, he has to appear, and if he has to appear in the Delhi Medical Council for hearing, not for the there can be multiple hearings for that matter. He has to leave the clinic, he has to leave the family, and he has to come for that disciplinary committee hearing. So time consuming as well as energy consuming also there. Then financial implications are also involved with that. There's also a stress factor, because if he employs a lawyer, of course, in that Delhi Medical Council, we are not allowing the lawyers to represent either with the doctors or the complainants. But most of the time, it is seen that the patient file a complaint to the Delhi Medical Council, also to the consumer court, also to the criminal court. So, poor doctor has to hire a lawyer. That means he has to pay fees to that lawyer, and we all know that the lawyer are taking the fees. What fees they are charging for that matter? Senior lawyer charging for that not less than 1 lakh. You will get an average senior lawyer, or the senior lawyer who will be charging for that matter 3 lakh, 5 lakh, etc. for that matter. So financial implications are also there. The next slide says. Then professional isolation. Once a complaint is being filed, doctor being asked to come for the medical council, he feel himself to professional isolation. He don't talk to his colleagues, friends, thinking that they will not talk to him, they will take him as inferior doctors. So he will feel himself in the professional isolation phase. Then fear of losing license. Of course, when the case come to the medical council for hearing, our job is, so we have to take the license of that particular. We can depanel the doctor, we can deregister the doctor from the Delhi Medical Council register. So medical license can be terminated, and that is a very grave thing, because the once a license is being terminated, that means he cannot practice during that period. That means he cannot practice. How will he earn for that matter? He has to take care of the family, children, wife, and parents also. So the fearing of losing license is always there. Then public scrutiny. Public, if the cases of say media can take up the case, or the public, that means the poor doctor is in the public scrutiny also. Was the patient filed a complaint against that particular doctor, and of course we all know the role of the media. They are doctors are being extorted by the media. Sometimes they have to pay to the media to stop that news for going to the air. Then impact on future objective. Once the complaint is being filed against the doctor, then of course he is seen that there is some, whether he is being acquitted or whether it is being convicted. Even if he is acquitted, there is no negligence against the doctor, but there is job prospects are on that particular doctor has to take because other hospitals, other nursing homes think not that the complaint is being filed. There must be something for that matter. Then impact on patient trust. We all know that once that complaint is being filed, then of course losing the trust of the other patients also. And impact on mental health with the prolonged stress associated with malpractice can lead to the burnout, anxiety, and depression. So these were the stressors for that matter when the person come to the Delhi Medical Council for hearing. Thank you, Dr. Chawla, sir.
Thank you, Dr. Tyagi, for enlightening us. So everybody is under stress once they reach to the DMC. DMC में पहुंचते ही बंदा टेंशन में हो जाता है. आपने राइटली बताया कि ये चीजें हैं जिससे बंदा टेंशन होता है.
Dr. Chawla, not only the DMC, whenever a doctor get a notice from any authority, whether it is police, whether it is court, whether it is Delhi Medical Council, whether it is Medical Commission, of course, stress factor and adrenaline flows is increased at that time.
बिल्कुल, you're right. Next question to again Dr. Sharda Jain. What is your advice to a medical professionals to manage the stresses in day-to-day life to make their life easy? Because you are a very experienced person, so you can guide them as a teacher or as a preacher. You share your screen and
Yes, sir.
Yes, ma'am.
Just 1 minute, sir.
All the panelists are requested to keep the time limit, please.
Sir, as you rightly said, I think gone through in the last 50 years all the stresses of medical profession. My priority is that self-care and the well-being should be the most important. ऐसा यहाँ से नहीं लेके जाना. You have to leave a legacy behind. और जो भी आपने समय बिताना है, you should be peaceful, you should be healthy, you should enjoy this. And I think, we must prioritize self-care and ensure that we are getting enough sleep, we are eating healthy, we are doing some exercise, and, we have time for relaxation, hobbies, spending quality time with our friends and family. And I think, I'm myself a preacher of yoga and meditation. I feel, that is very important to keep you balanced in life. Time management has to be taught to each and every medical student, and they must learn how to do prioritization. इसको सीखना बहुत जरूरी है. And हर आदमी के लिए अपनी priorities अपने आप को decide करनी पड़ेगी. And I think, one has to be very careful as far as developing some hobbies and not to ignore things like meditation. I think, during COVID times, people like us, we never learned music, but I think, we started a music things for ourselves so we can relax. Some people picked up dancing and gardening, and I think that is very, very important. What is required mostly is the peer support, because I again repeat, 90% of litigations are instigated by your own colleagues. So जब तक ये fellow feeling उन पे नहीं आएगी, तो ये वाली जो चीज है, unless the friends support you when you have a problem, this is I think we have to do at the individual level, and we have to do at a society level and at the DMA level. I think, benefits of sharing experiences. When you've gone through couple of litigations yourself, I think this is the time to share your knowledge. People like we have been doing this selfless service for the last 20 years. Whenever people have litigations, I definitely guide them as an elder. And I think as association is concerned, Delhi Gynecologist Association, they give them affidavit, which is very handy for lawyers, which comes as a back support for them. And I think, we are there to take away, because I find personality of a person changes altogether. And professional help is very much required. आपको elders की support चाहिए, elders से guidance चाहिए, आपको medical legal support चाहिए, आपको legal support चाहिए. तीनों चीजें आपको चाहिए. And finally, you have to sit down in a very cool mind. What has happened to you? You can put down in things like that. And I think, all these people, when we have a depression and anxiety, the counseling has to be done by the professional people as well as by elders, colleague, and your friends. Strategies by elders have become very handy as far as medical profession are concerned, because they can definitely tell you, bhaiya apni responsibility samjho, reduce your workload, and prevent your burnout. I feel the meditation is the biggest healer. Each one of us during our school time, we must see to it that this particular part we learn it, and not only once we learn it, we must train others also in learning this meditation part. And I think there should be time for your diet and your exercise and your family, and so to reduce the burnout. I did tell you that I'm a yoga trainer and a meditation trainer myself, and I feel that we have to learn counseling, communication, and documentation. These three things, if you do, you can prevent 50% of litigations. And Dr. Tyagi is here. 80% of our litigations are because of the poor communication between the doctor and the patient. And this we got to learn it. And when we listen, it has to be active listening, and the empathy is a subject by itself, and I'm not going to dwell on that particular thing today. We must also use a simple language. भाई आपके साथ क्या होना है? जो आपने consent लिए, बस आपने उतना ही काम करना है. Jargon और अपनी flary language गाने की जरूरत नहीं है. Conflict resolution has to be there. We do it with our friends. We do it with the nurses. And this conflict resolution with your patient also, थोड़ा सा 2 मिनट के लिए low करना पड़ेगा अपने अभिमान को. But I think it's worthwhile doing that conflict resolution with your patients. And I think it's all teamwork. It's a collaborative effort. जब even आपके colleague के ऊपर stress है, आपके ऊपर stress है, तो ये आपका भी stress है, that you have to come out as a teamwork person, and in your all possible way you should help them out to this burnout is lessened to a large extent. I always say that join IMA, join DMA and local specialty group, because जो local लोग हैं वही आपको मदद करेंगे और कोई बाहर का मदद नहीं करेगा आपको. And we must have this stress buster programs for doctors to build mental strength. At the same time, I'm a firm resolution I have in my mind to lead a happy, healthy, and a peaceful profession. We must love ourselves, we must appreciate ourselves, and we must respect ourselves. Nobody else is going to do it. We have to do it ourselves, and you'll find that you will be mentally very, very strong in this particular thing. Advocacy for change in this burnout is पहले तो self-care की बात मैंने आपसे कही. And then secondly, elders and the mentors in the profession have to come forward for improvement in policy changes that can reduce the stress. And again, doctor community have to work together to work with authorities and things like that. And I'm sure all the respected people are here for working hard for all of us for security, which is physical security, mental security, and emotional security. Thank you very much, sir.
Thank you, ma'am, for the nice words. एक चीज मेरे को अच्छी लगी मैम कि शेयर करना बहुत जरूरी है. अगर आधे कहते ना दिल की बात बता दोगे तो काफी दे देंगे, और अपने दोस्तों से बहुत जरूरी है. दे विल हेल्प यू डेफिनेटली. कोई करे ना करे, दोस्त आपके जरूर हेल्प करते हैं. और ग्रुप ज्वाइन करने चाहिए, सब मेडिकल स्टूडेंट जितनी ज्वाइन करें, उससे हम डिस्कस करेंगे, एक दूसरे शेयर करेंगे, तो वी कैन सेव आवरसेल्फ. सो नाउ माय क्वेश्चन इज डॉक्टर भाटिया. Dr. Bhatia, what is your expertise you want to share or the advice medical professionals, especially the young brigade, to keep the stress free in this era? Please hurry up.
Yes, Dr. Chabra, can share my slides. Very first thing is one must go for the self-talk.
Mm.
Self-talk is very important. One must, the next slide, please. One must go for self-talk and ask yourself few questions. Are you content and satisfied? Are you always complaining to yourself? What causes you to feel stressed? What makes you happy? Always choose to be happy. I appreciate Dr. Chabra. He always used to say, be happier. Choose to be happy. And are you irritable? Are you anxious? Are you depressed? Ask this question, each and everyone through this platform, whosoever is listening to us, he must ask this set of questions to himself. Next slide, please. Dr. Chabra. Set your goals. Take care of yourself. As Dr. Chabra has very well said, eat right, exercise at the right time, and get enough sleep. I really love sleep. And relax often as much as possible. So next slide, please. So get enough sleep. Next slide, please. And one can pamper himself by massage himself or herself. Next slide, please. And one can go for yoga, as Dr. Sharda has very well already told. And walking, it is, some papers have shown that walking alone without any devices, without on being Wi-Fi, was listening to anything, it de-stress yourself a lot. 30 minutes per day. Next slide, please. So vending is very important. You must share with your friends your negative things, whatever is coming inside you, you must share with your friends and always choose to be happy. Next slide, please. So through this platform, my advice to the workplaces, if required, workplace modifications sometimes are required. One must establish a physician health committee in the hospitals, and there should be mental programs should be there, and there must be confidential support groups, and annual well-being retreats should be there in the bigger corporate hospitals and the government hospitals too. Next slide, please. And changing again, basically physicians, doctors, we always feel that we are made to give, not to take. We must prioritize that we are not only to give productivity, sometimes we also require help, and we should be prepared to take the help. And one should take membership to fitness clubs and CMEs like this CME we are doing right now, being managed by MedTalks, thanks to MedTalks. These CMEs must be continued, and our schedule should be flexible, and paperwork must be decreased as much as possible. Next slide, please. And recently there was this protest, Chalo Rajghat. My thanks to the DMA management and DMA leaders. Basically, in this, we should feel that we are not alone. We are not alone. We are not only sufferers. The whole community is suffering. Through this, we basically एक जागरूकता लेके आया ये प्रोग्राम हमारा चलो राजघाट वाला जो 29 अक्टूबर को हुआ था. And these sort of programs must be continued. Next slide, please. And I love this slide. See, friends, everything, your work, your money, your family, your dreams, everything becomes zero if your health is zero. So you make your health at number one, then the figure will run in millions. Maybe it is your emotional health, or it is physical health, or it is financial health. Thank you very much, Dr. Chabra.
थैंक यू डॉक्टर भाटिया, आपने बहुत अच्छी अच्छी बातें बताई ये स्ट्रेस को कम करने के लिए. नाउ माय नेक्स्ट क्वेश्चन टू डॉक्टर एवरिल माथुर. डॉक्टर एवरिल माथुर, यू आर द प्रेसिडेंट ऑफ द फोर्डा. आपकी एडवाइस बहुत बच्चों को काम आनी है, तो आप अपनी एडवाइस बताइए. अपनी स्क्रीन शेयर कर लीजिए आप.
सर अनफॉर्चुनेटली इस चीज के लिए मैंने कोई पीपीटी प्रिपेयर नहीं करी, बिकॉज़
आपकी एडवाइस
इसमें एक्सट्रम्पोरी ज्यादा
जो 4 मिनट आपके में ये ज्यादा इंपॉर्टेंट है.
जी सर, वही
आई विल नॉट स्टॉप हियर.
इसमें एक्सट्रम्पोरी हम लोग दिन भर सर यही काउंसलिंग और गाइडेंस देते रहते हैं. बट आई थिंक वेरी नाइस प्रेजेंटेशंस एंड कलेक्शन ऑफ जो सारी चीजें करनी चाहिए बाय डॉक्टर शादा एंड डॉक्टर भाटिया अगेन. सर अपार्ट फ्रॉम जो दोनों रिस्पेक्टेड पैनलिस्ट ने कवर किया है, मेरे को लगता है सर रेजिडेंट इज वन फिगर हु इज वेरी इजी टू सेटिस्फाई एंड जिसको बहुत जल्दी से खुश करा जा सकता है. बस अगर कुछ थोड़ी सी बेसिक चीजें उसके हिसाब से कर दी जाए. वो एक ऐसा ही इज वन एंटिटी जो ज्यादा कुछ मांगता ही नहीं कभी किसी से. अगर उसको एक बेटर वर्क प्लेस एनवायरनमेंट मिले, जैसे कि उसके सीनियर्स उसको डांटे ना, उसको मेंटली और किसी और तरीके से हरास ना करें, उसको उसकी सैलरी टाइम पे मिले, उसको ड्यूटीज के बीच में एक एडिक्वेट ब्रेक मिले जिसमें वो एक अच्छा खासा फंक्शनल डीडीआर मिल सके, जिसमें अच्छे खासे फंक्शनल वॉशरूम्स हों, उसको एक कैंटीन मिले जो जैसे कि हम लोग सर इन आवर इंस्टीट्यूट्स एंड ऑलमोस्ट ऑल द मेजर इंस्टीट्यूट्स वी हैव स्टार्टेड एन इनिशिएटिव of handling the canteens by the RDA, not under the hands of the administration, because RDA understands what the student needs, what they need to eat. We get a confluence of students from southern India states, many other states, and therefore we take into account their demands, and उस हिसाब से हम लोग उनको facilities देते हैं, तो उसको ये मिले। मेरे को लगता है कि सर, जैसा भाटिया सर ने बताया, ये जो वेंटिंग वाली स्लाइड थी, ये बहुत ही इंटरेस्टिंग स्लाइड थी सर। तो वेंटिंग को हम लोग जैसे बोलते हैं कि कैंटीन में गए या फिर 4 लोग बैठ गए नेस्कैफे पे कॉफी पीते हुए, और 4 लोगों ने बैठ के जम के अपनी भड़ास निकाल दी, उस दिन के राउंड्स की, उस दिन के सीनियर की, एसआर की, कंसल्टेंट की, जो भी गंदगी थी मन में, वो सब निकाल दो। So, we have to foster an environment where people can reach out to other people. Therefore, what we are trying to do is we are trying to integrate RDA as a very, very important member right from the first year. Sir, you would be surprised in Maulana Azad, जो अभी PGs का orientation होने वाला है, उसमें हम लोगों ने अपना एक सेशन रखवाया just to condition them right from the very beginning when they join as PG first years, ताकि उनको पता रहे कि एक एसोसिएशन है जो उनके लिए है, उनकी बातें सुनती है। So, and of course, as residents, they should also understand that they should not follow the crowd mentality. The herd mentality यहाँ पे चल रही है of giving exams over and over again, कि वो ये कर रहा है, मैं नहीं कर पा रहा, मेरे को भी करना चाहिए। They should understand this is a confluence of their different trajectories for a limited period of 3 years, 4 years, and then they will all go their separate ways. सबका अपना अपना एक अलग trajectory होता है। They should not, try to chase somebody else's goals or align themselves by somebody else's aspirations. And of course, if जो जैसे Dr. Shada और Dr. Bhatia ने भी बताया, meditation, having a work-life balance, finding something that you like, spending the money that you're earning on something nice, of course they don't find time for it. तो ये सारी चीजें करने से सर बहुत सारी दिक्कतें हैं जो दूर हो जाएंगी। बाकी सारी जो दिक्कतें हैं सर, वो तो पेरिनियल दिक्कतें हैं इस देश में, इंफ्रास्ट्रक्चर, डॉक्टर्स की सीटें कम हैं, मरीज ज्यादा है, वो सब चीजें तो सर एडमिनिस्ट्रेटिव लेवल पे आई एम श्योर आप जैसे सब बड़े लोग उसको सुलझा ही रहे हैं, पर उसको ये चीजें मिल जाए वो खुश रहता है सर, उसके 3 साल कट जाते हैं।
थैंक यू डॉक्टर अविल, आपने बहुत अच्छी बातें बताई। सबसे बढ़िया जो डॉक्टर भाटिया ने बताई आपने, तो वेंटिंग वेरी वेरी इंपॉर्टेंट। जब तक आप दूसरों से शेयर नहीं करोगे, आप अंदर बैंकअप होता रहता है, आपके माइंड में बैंकअप होता रहता है। वेंट करते नहीं तो हर बात इरिटेट रहेंगे, पेशेंट आपसे बोले इरिटेट रहेंगे। जब आपने भड़ास निकाल के कैंटीन से जाके वापस आ गए, फ्रेश हो गए आगे, तो वो बहुत ही ज्यादा इंपॉर्टेंट है स्ट्रेस को कम करने के लिए, वेरी वेरी इंपॉर्टेंट। सो नाउ आई विल कम टू डॉक्टर त्यागी। आप बताइए, वेरी वेरी इंपॉर्टेंट है, क्योंकि जो डीएमसी में पहुंचने के बाद, व्हाट इज योर एडवाइस टू मेडिकल प्रोफेशनल्स टू reduce their stress and the fear while they come for the hearing?
As Dr. Shada Jang has already told you, I will just stress again on that point also, that in this present era, your litigation against the doctors cannot be prevented. You just you can reduce that litigation.
Yeah.
How can you reduce that litigation? It is by that 4 things. One is communication, another is documentation, third is communication of documentation, fourth is documentation of communication. If you follow 10 to 20% of these, most of the litigation against us will be reduced drastically. I can assure you that. And based on our experience at Delhi Medical Council, the 70% of the complaints are because of poor communication. Poor communication by the doctor or poor communication by the nurse, because nobody is communicating properly with the patient or the relatives. Then do ethical and fair practice. If you are doing ethical practice, fair practice, I think there are less chances of litigation against you, less chances of that you will be called at Delhi Medical Council. Then do not tamper with the records. I'm just stressing to our colleagues, doctors who are just going through this session, do not tamper. If you are tampering with the record, you are liable for criminal action. So once apart from that disciplinary action, which has to be taken by the Delhi Medical Council, if you are tampering with the record, you are liable for criminal action. That means you are liable for that police action, and you will be feeling more harassed and you will feel more stressed for that matter. Then update your knowledge. That is a prime point. Update your knowledge through your CME, CPD, and go through that IMC regulation 2002 or NMC regulation 2023, which are, of course, NMC regulation 2023 is kept in abeyance, and the IMC regulation 2002 is still in force. So every doctor should go through that. What are the professional misconduct? What are the unethical behavior? What are our duties to our patients? What are our duties to our colleagues? We should go through that matter. Then once a notice is being called off from Delhi Medical Council to you and you are asked for the company, you must attend that hearing because it is giving you a chance to appear before Delhi Medical Council and put your defense before that council members and the experts that there is no genuine complaint for that matter. Then you can address while you if you appear before that. If you are not appearing before the medical council and if you are being called, then of course the case will be decided in the merit and you will lose a chance to defend yourself. Then when you appear in the Delhi Medical Council, be confident. Don't afraid, be confident and while appearing before the Delhi Medical Council. And one is be thorough with the complaint. Whatever because when we ask the doctor and the complaint party to come before the medical council, we served a copy of complaint to that concerned doctor. Before that, he replies to. So be thorough with the complaint. What are the issues raised in the complaint? Just go through that properly so that you will be in a better position to address those issues before that expert of the medical council. Be thorough with your reply. Whatever reply you have submitted to the medical council, when so just go through that because we will be asking questions from a reply, asking questions from a reply. So if you have submitted a reply and you want that there should be some modification, that you can submit addendum at the time of hearing also. Then be thorough with the patient records because whatever the records available with their at the hospital or the nursing home, go through that particular records because ultimately the question will be raised or the deficiencies of yours will be highlighted based on those your reply and based on the records. So just go through the record that what was the pulse at that time, what was the post-operative, what is the consent, whether it was proper or not. So you have to go through the record properly also. Discuss with close friends, as Dr. Parveen Bhatia, Dr. Aviral, Dr. Shahada Jain all told about that. Whenever there is a issue, whether it is a litigation or you be open with your colleagues because ultimately your colleagues will help you out in some way or the other. And focus on positive things, which all the learned experts have told about, that meditation, yoga, walking, and so these kind of things will make you stress-free while coming to Delhi Medical Council. And I hope that if you are doing ethical and practice and in a fair way, you will not be called to Delhi Medical Council. And if you follow that, what Dr. Shahada Jain advised, that take care of your consent, documentation, communication, at least 80% of the complaint will not be there. Thank you, Dr. Chabda.
Thank you, Dr. Tyagi, for excellent. दो चीजें हैं कि आपको एक तो रिकॉर्ड जो है कभी भी टेम्पर नहीं करने चाहिए क्योंकि आजकल डिजिटल जमाना है, कोई आपके डॉक्यूमेंट्स की फोटो खींच के ले जाए और आपने वहां टेम्परिंग कर दी तो पहले ही आप फंस गए. एम राइट? वो क्रिमिनल एक्ट होता है अगर आपने उसको कर दिया तो उसको टेम्पर नहीं करोगे आप पहले. यही बात है डॉक्टर त्यागी?
बिल्कुल बिल्कुल, टेम्परिंग तो बिल्कुल नहीं करनी आपने.
टेम्परिंग नहीं करनी है.
You don't think of tempering the record.
सेकेंडली आपने कॉन्फिडेंट होके बोलना है और कॉन्फिडेंट नहीं बोलोगे तो कुछ लोग गलती करोगे आप. ओके, दीज आर द बहुत अच्छी चीजें बताई त्यागी साहब ने, इससे हम स्ट्रेस फ्री रह सकते हैं. सो आजकल क्या है कि स्ट्रेस को खत्म करने के लिए मिथ है. एवरीबॉडी नोज कि यू कैन कीप योरसेल्फ स्ट्रेस फ्री एंड द हेल्दी विदाउट द मेडिसिन. इट इज ए मिथ. स्ट्रेस फ्री सिचुएशन और द हेल्थ does not always come from the medicine. Most of the time it comes from the peace of the mind, peace of the heart, peace in the soul. It comes from the laughter and love. That's why we say laughter is the best medicine. So हमेशा हंसते रहना चाहिए. जब भाटिया ने बताया, मैडम ने बताया, तो हंस के बात करनी चाहिए. तो laughter is the best medicine. योगा निद्रा सबने बता दी है, योगा बता दिया है. A few more etiquettes. Learn to say no. हम क्या करते हैं, जो अपने सीनियर आता है, ये काम कर लोगे, हम कहते हैं कर लेंगे. कर सकते हो, अगर नहीं कर सकते तो आपको स्ट्रेस में जाओगे. सो ट्राई टू लर्न से नो कि मैं ये नहीं कर पाऊंगा. सो बी थैंकफुल एंड लिसन टू द म्यूजिक रादर देन टू सी द वॉच द टीवी. बिकॉज जो म्यूजिक है जो आपको स्ट्रेस कम करता है, टीवी से कोई ना कोई आपको सीन ऐसा देख लिया तो स्ट्रेस कर देगा. रिलैक्सेशन बता दिया आपने, कि योगा बता दिए. आपको मैं ABCD बताऊंगा. ऑलवेज टेक टाइम योरसेल्फ फॉर एटलीस्ट 30 मिनट. डॉक्टर भाटिया ने बताया. Be aware of the on stress meter. Know when to step back and the cool down. Concentrate on the controlling or your on. अपने आप को कंट्रोल कर लोगे तो स्ट्रेस फ्री हो जाओगे. Without controlling the everyone. दूसरों को कंट्रोल मत कीजिए, अपने आप को कंट्रोल कीजिए. Daily exercise and will burn out the stress, and eat a lot of the fresh food, and everybody tolerate. Forgive others. Don't hold the grudges and be tolerant. Not everyone is capable as you. Gain perspective of the things. How important is the issue? Hug or the kiss, very very important. जब आप किसी मिले हग करेंगे, हंसेंगे, तो आपका स्ट्रेस कम होगा. Identify the stressors and plan to deal with them better next time, because if you are not unable to handle the challenges, then you will be under tension. Judge yourself on performance realistically. Don't get goals out of your reach, and keep a positive attitude. Your outcome will be influence outcome comes and the way others are treated. Limit alcohol, drugs, everything should be avoided, and manage money well, and keep the 10% for saving for your future. And no is the word you should learn. An outdoor activity by yourself or with the friend or the family can be a great way to relax. And every time, every weekend, you should relax and play your favorite music rather than the TV watching TV. Quit smoking, as I told you, and relationship nurture and enjoy them. Learn to listen more and talk less, and sleep well, as I told you. Treat yourself once a week with a massage, dinner outside, or the movies if you can. Understand things from the other person point of view. Verify information from the sources of the before the exploring, and worry less. And yearly goal setting plan what you want to achieve the based on the your priorities and your career, and just for the life each a day as a gift, and smile and thankful that you are the part of the beginning. So important fact of the life. Everybody knows big difference between the money and the time. Everybody knows how much money you have in the bank or with you, and you don't know about the time, what time you have. But let us always value the time. So, dear friends, final advice with the thanks. So enjoy your life as it comes, and always be happy. Thank you very much to all the panelists. And now the session for the question answer. Ms. Batoon, over to you. Or to the organizer for the question answer. Batul?
Yes, am I audible?
Yes, you are
I have the
audible.
question. Batul, unmute yourself.
No questions.
No question. Everybody knows all the things. Madam, final words from you.
I always say, stress ka koi fayda nahi. Worry means that you're thinking worst about that situation. One thing, priorities we must know. Time management we must know. Self is very important. कोई आपको सोचेंगे, आपके क्लोज फैमिली मेंबर्स भी आपका ध्यान नहीं करेंगे अगर आप खुद अपना ध्यान नहीं करेंगे. तो आपको अपना ध्यान जरूर करना है. और एक बात फिर मैं फिर रिपीट कहूंगी, पैसा लेके नहीं जाना है. You got to relax yourself. If you have had a medical problem, कोई भी आपके साथ नहीं होगा. तो इसलिए प्लीज वर्क टिल दैट टाइम कि जब तक आपको लगता है कि स्ट्रेस, जहां स्ट्रेस आपने स्मेल किया वहां से तो हटना ही पड़ेगा. थोड़ा बहुत तो स्ट्रेस चाहिए ही चाहिए.
Thank you so
Now,
much, ma'am.
Dr. Bhatia, just 2 minutes. Final word. I will take one by one panelist. Dr. Bhatia, final words.
Final words, basically through this platform, I would like to convey the message to all the professors and seniors that एक दूसरे की nagging ना करें हम लोग. Especially in the ward rounds में क्या होता है कि juniors को ये दिखाने के लिए professors या senior लोग जो हैं ragging करते हैं, questions ऐसे पूछते हैं ताकि patients को मालूम हो जाए कि हम senior है junior हैं. Yes, patient को मालूम है कौन senior है कौन junior है. हम लोग इस फेज से निकल चुके हैं, इसलिए बोल रहा हूं मैं. तो this type of thing should not be encouraged. My request to all the seniors and professors in the medical colleges that juniors should not be nagged in the wards.
Dr. Avril, your final words.
Sir, I think Bhatia sir ने कह ही दिया. पर इसके अलावा आई बिलीव कि एक थोड़ा सा कलेक्टिव सोशल रिस्पॉन्सिबिलिटी शुड बी टेकन बाय ऑल द रेजिडेंट्स. दे शुड आइडेंटिफाई पीपल जो उनके कलीग्स हैं, उनके सीनियर्स हैं, हु आर एट रिस्क, जिनको बहुत ज़्यादा स्ट्रेस है, जो जानते हैं कि इनको दिक्कत है, and help them in any way possible and help them reach out to their local RDA या कोई भी representative body जैसे कि हम लोग हैं, and maybe through proper channel we'll be able to help them alleviate the stress.
Dr. Tyagi?
Thank you, Dr. Chhabra. पहले तो we should start appreciating our colleagues.
Yes.
Start appreciating. Don't criticize. If you have some issue with that particular person, talk directly to him, not
Yes.
with other colleagues, not in front of the patient. As Dr. Praveen Bhatia told, we should support our juniors. We have come to a stage where we should, if we are supporting our juniors, RDA people, Dr. Aviral Mathur and our RDA's people, we should support them. Whenever there is an issue of RDA, we should go with them, we should support them. And that means we will support us also, we will support our generations to come, so that their issues with the area-based authority, if they are not getting a stipend or the salary at the right time, so we should support. They might be they will not be in a position to go against that government of the particular government or particular authorities, but we as seniors support them, asking the authorities to take care of their issues. If we are doing little bit of this, then of course they will be stress-free. And as I told you, Dr. Sharda, all our esteemed finalists told you that stress is the main factor, and we should take care of our juniors so that they are stress-free. At least they are stress-free. These are my takeaway message.
थैंक यू, अच्छी तरह बताया आपने. ऐसा है कि जब तक स्ट्रेस आप लीजिए हो, जब तक आपको हैंडल नहीं कर पाएंगे कोई भी चीज हो, आप उसे स्ट्रेस होने की बजाय कूल माइंड से सोचिए. गिव द टाइम. जब आप पे प्रॉब्लम आती है तो प्रॉब्लम का मत सोचिए, उसका सोल्यूशन सोचिए, तब आप कुछ कर पाएंगे. दूसरा क्या है, बातचीत से काम चलता है. अपने दोस्तों से काम कीजिए, जैसे सबने बता दिया. तो दीज आर द वर्ड्स. स्ट्रेस को कम करने के लिए हम एक दूसरे का स्ट्रेस कम करें, एक दूसरे कर सकते हैं, अदरवाइज अपने आप नहीं कर सकते. दूसरों को ठीक करने की कोशिश मत कीजिए, अपने आप को ठीक कीजिए. दिस आर माय लास्ट वर्ड टू द नाउ the platform to the organizer for the vote of thanks. Batul?
So much, sir. Thank you for giving your valuable time and for sharing such valuable insights upon the topic that each and every solver has shared by particular talk and by giving such an amazing answer for the talk that all the questions that were asked. So thank you so much to all of them. Before concluding, sir, there's just one question upon which we would like to have the opinions of all the solvers. And the question has come from Dr. Karan Juneja. Dr. Karan Juneja wants to know easy methods for stress busting. So we have discussed this in our talk, but last opinion upon this question that will be taken by each one of you. What are the easy methods for stress busting according to these solvers present?
Thank you. Thank you.
Thank you, sir. Good evening, everyone. Thank you.
Good evening.
Thank you,
Yeah,
sir.
good evening.
Okay. Bye bye.
Bye bye bye, sir.
खुश रहिए, मस्त रहिए और स्वस्थ रहिए.
Thank you, sir.